Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author. Did you know that up to half of children diagnosed with autism can recover if they are treated very aggressively with ABA therapy when they are very young? It was first shown that kids with autism could become indistinguishable from their peers in a classic study done by Dr. Ivar Lovaas, published in 1987. That is 30 years ago. So just to clarify, 3 decades ago, some researchers knew that recovery from autism was possible using behavioral treatment. Yet, I bet this may be brand new information for you today. I've known that ABA could lead to recovery for almost 2 decades now, and I'm shocked that this is not commonly discussed in the media or known by many professionals and parents. As you may know, my firstborn son, Lucas, was diagnosed with autism in 1999, one day before his 3rd birthday. As Lucas was buckled in the car seat, completely silent during the 1-hour drive home from the hospital in Philadelphia, my husband, who was driving, was saying things like, "I guess he'll never go to college, he'll never drive, he'll never get married." I was crying at that point, told him to be quiet. I told him that I had prepared for the appointment, knowing that Lucas would most likely be diagnosed that day. And I had read Catherine Maurice's book, Let Me Hear Your Voice, which was published in 1993. In Let Me Hear Your Voice, Catherine Maurice reported that both of her children became indistinguishable from their peers after intensive ABA programming, and said that according to Dr. Ivar Lovaas, who set up the original ABA protocols, up to half of children who receive ABA can get all better. They could become indistinguishable from their peers and not need support on a long-term basis. When I read Maurice's book in 1999, I had tremendous hope. When the doctor did diagnose Lucas, he confirmed that intensive ABA programming was the best treatment for young children with autism. I specifically asked the doctor if Lucas could recover like the book had said. He told me that because Lucas had moderate to severe autism, that he was not that optimistic. That maybe if we would have brought him in earlier, maybe his chances of recovery might have been better. He basically said that he had seen kids get all better from autism, but those were more mildly affected kids. I still told my husband that we were going to start ABA 40 hours per week, that Lucas was going to recover despite the odds, and that we were going to have a recovery party. I talk about my desire for a recovery party in my book, The Verbal Behavior Approach. And on the back cover of my book, Dr. Mark Sundberg, who wrote the foreword for my book, said that my book, is one of the most valuable books for parents of children with autism since Let Me Hear Your Voice by Catherine Maurice. According to another author, Marina Saris, from the Interactive Autism Network, 2 nationwide large studies have shown that 4 to 13% of children will lose their diagnosis by age 8, but they often do keep other diagnoses such as language delay or ADHD. Children diagnosed before 30 months who had less severe symptoms to start had the best chance of recovery from autism. I have worked with hundreds of kids with the diagnosis of autism and dozens of very young children with signs of autism. Some of them have become indistinguishable. I have seen signs and symptoms of autism reversed and sometimes eliminated, especially when I've treated very, very young children. Whether the recovery rate is 4% or 47%, it's not 0, and the earlier you intervene, the better. I'm in the process of creating an online course for moms and dads of toddlers, 1 to 3-year-olds, who are at high risk of showing signs of autism but not yet diagnosed. These toddlers may be receiving early intervention services. You may be on waiting lists to be seen by a developmental pediatrician, or he or she may have an older sibling or cousin with autism, putting them at a higher risk of autism. My mission with this project is to teach parents how to intervene to help prevent or reverse autism symptoms in toddlers showing the earliest signs of autism. If you are a parent of a toddler with delays and/or you are worried that your child may have autism, please take this short survey so I can ensure when I create my program it will help you. Please share the link with any parent of a toddler with delays or to parents of 1 to 3-year-olds who want to learn strategies to prevent, treat, and possibly reverse the earliest signs of autism. While my 2 current online courses are for both autism professionals and gung-ho parents of toddlers through teens already diagnosed with autism, this new course will be just for moms and dads, grandmas, nannies, of toddlers who are not yet diagnosed. Please take the survey by clicking the link right below this video if you fit this category, and I'll touch base as soon as possible to share the survey results. Thank you.